And we are live.
And we are live. Let's see when it's into the Facebook land. There we go. Make sure my phone's turned down so I don't get feedback. Hi, everyone. It is October 23rd. It's the end of the month. My brain is barely working because I was at a trade show all last week, and I think it's Monday. It
doesn't feel like Monday, but it's Monday.
I know. It's like I've been home for a few days, but not really, I feel. And then I leave again Wednesday. So I've been like hammering in the Facebook Lives this week. Last night I had one. I have one with you tonight. I have one with Dawn tomorrow night. And then I leave. So it's our monthly Facebook breastfeeding and pumping Q&A here with Shari Criso, and sponsored by Evenflo Feeding. We are giving a breast pump away, so make sure you click that link and RSVP and enter your information. But you all know who I am. Whatever, you follow me. I'm definitely in a onesie this evening. It's a onesie courtesy of Leah Michelle. Random, I know. But Shari, why don't you introduce yourself to the people who might not know who you are?
Hi, everyone. Welcome back. So happy to be back with you guys. So I'm Shari Criso, and I am a friend of Jamie's for almost a decade. We have known each other, played together, worked together, just done it all.
We have Brittany together.
We have Brittany together. Yes, we have. We have pumped together for many a time. I'm a registered nurse, a certified nurse midwife, and an international board certified lactation consultant. I work with Evenflo Feeding, help to develop their advanced hospital grade, hospital strength pump, and they have my classes included with all their breast pumps. So they provide education, and I give it to you through that. So we've been doing these live streams for 3 years now.
This is almost our third year. We have 2 more of these, and that'll be the third year.
It's insane. You know how many lives there's been? I mean, when you count up sometimes we went a couple times in one night, but I think there's like 35 of them.
Wild.
Yeah, it's really intense.
I should go through at some point and actually look at the insights and see the collective reach
of all of them, right?
That'd be all. I'm going to do that.
That would be a cool fact, right?
Yeah.
But yeah, it's so good to be, it's so funny. Last week, Jamie made a surprise appearance on my page. And it looked exactly like this. I'm looking at you again here, but now I'm here. So, yeah, it's really awesome.
Yeah. So we're just here. I have a glass of water and I have a glass of a red blend because it just felt right. It's chilly out.
And I have my mango drink here, which is non-alcoholic because I have questions to answer for all of you, and I will be too stupid to answer them if I drink anything.
The thing is, I'm here as like a cheerleader and conversation starter and whatever. Shari's the one with all the information.
Oh, please. You know some stuff at this point.
I know some stuff, but there are things I'm just like, no clue. So I always have a little glass of wine or a hefty pour, depending on what country you live in and what your life is like. And so we just answer questions. And right now, I'm not looking at my Facebook app, so I can't really see. But we're going to need some hearts, I've decided. Are there some good hearts right now?
There's some good hearts. I see a lot of laughing faces. Now I see the hearts.
We need some hearts to start off. And everyone, let us know where you're from. Let us know if you are pregnant. Let us know if you have a kid, if you are nursing, if you are pumping, if you're doing a combination of both, if you are an exclusively pumping mom. Just let us know your life. Let us know your life so we know who we were talking to. And it's like whenever I do my speaking events, I always ask at the beginning, because it's a lot of people I don't know. I'm like, how many of you are pregnant?
Mm-hmm.
I need to know my audience so we know who we're talking to.
Yep.
So let us know. And then here in a moment, we'll just get to questions.
Awesome.
Because we got a few.
Here. So nursing my 2-year-old. Hi, Jillian. Due in 3 weeks.
Good.
Mama from Texas, Minnesota. She's still nursing her 2.5-year-old. Woohoo.
Awesome.
Got a good mix here tonight.
Have a 2-year-old trying to conceive again. Good luck. Happy fertility vibes. Tandem nursing. Very good. Very sensible.
Awesome.
Carly, obviously in Calgary, Alberta. There's Rebecca. You have a 13 and 14-year-old, so I hope you're not nursing them. I do believe you got to cut off at some point, quite frankly.
There is a point.
If you're nursing a 14-year-old, that's some Game of Thrones stuff I don't even want to get into right there. That's...
Oh, Jamie, it's so early in the night.
It really is. It really is. Even though I fully think I could just go to bed right now. So, shall we just get to questions, Shari?
Yeah, let's get to questions. Can we show them what the prize is tonight, too, before we start?
Yeah, so talk about the prize we're giving away.
Okay. So this is the prize. It's stuck. This is the Evenflo Feeding Advanced Double Electric Breast Pump. Awesome pump. We're going to talk about the features in a little while, as we usually do, because it's really important for you to know what you're looking for when you're looking at a breast pump. And this is it. And so this is going to be the prize tonight. So in the post here, you actually need to register to win. There's a link. I'll post a link real quick. This is the link right here. And then it's also in the post too, so that you guys can make sure that you register and comment here to win tonight. But Evenflo Feeding's in the house. I can see them. And they're just my favorite. And what I love is that it's a product that just is so well thought out. Every feature that you would want in a breast pump. It works really, really well. It is just has everything that you need, including the education, to have a really good breastfeeding journey, pumping experience, and some of the things that I think we'll cover tonight. So,
yeah,
to say that.
I would also I just noticed. So, I have been on Facebook and the Instagram a lot over the past week, and I did a Facebook Live last night. No one has noticed my haircut today.
I'm trying to see through this. You're this big on my screen, so it's so hard for me to see.
I went and got all my curls cut off today.
Now that you mention it, I can see it.
Because, Shari, I'm going to tell you a story.
Uh-oh.
All the people here need to know this. So, ABC Kids Expo was last week, and I got way too busy, and I procrastinate with the best of them, okay? And I needed a haircut before ABC. So I call my place, and I'm like, I am leaving tomorrow. I really need to get a haircut. Can you get me in with any of my people? And they were like, we can't get you in with anyone. And I was like, okay, I did a good job here. I did a good job. I'll just get it when I get back from ABC. So do you know what I did? Shari, we all know I have the curly blonde hair.
Oh, don't even tell me.
Huh? So, no, it's going to be really bad.
Okay.
So the back of my neck grows hair very quickly. And when I worked at Bye Bye Baby, all the girls at customer service called me duck butt. Because it used to grow and it would get really curly and it looked like a duck butt. So I can deal with when my hair gets curly and whatever, because you could do product. But like a really hairy neck grosses me out. And I was like, I can't go to ABC like this. I might be meeting Britney Spears, which didn't happen, but we tried. We got backstage. Everything was great. I got out of the shower. Are you ready for this?
No.
I got my buzzers, my clippers, and I made my hand as flat as I could. And I just put it across the back of my neck and went and tried to like clean my neck up. And it was terrible. It was terrible. I did not even have time, if it looked bad, to go get it trimmed up and clean. It was so bad. So for the first 2 days, I wore like a puffy vest with the collar up and like my bag because I was so nervous about what it looked like. And then at ABC, everyone's out drinking anyway, so I didn't care.
Like anyone noticed, right?
So I got back. I showed it to Jennifer last night, and then I was like, Jennifer.
Cut hair.
Huh?
Doesn't she cut hair? Couldn't she?
I know, but she was busy. So Jennifer was at the apartment last night. I was like, Jennifer, I need to tell you what I did. And I told her, and she was like, luckily your hair is blonde and curly, so it doesn't read like it's fine. Then when I went to get my hair cut today, I was like, I need to talk to you about my problem. Like, this is what I did. And he looked at it. He was like, what the hell did you do back there? And I was like, exactly, fix it. So everything is good now. Now we're going to talk about breastfeeding.
And so he had to kind of match the top. It looks good.
I'm very happy with my haircut right now.
Good, yeah.
I'm very happy with it. So I'm not going to turn around. It looks fine right now.
No, it looks totally fine.
So let's get into questions. It's time. So Desiree has a question. I have a newborn, failed to breastfeed my first son, so this is new all over. I'm feeding with a nipple shield due to one flat nipple and one inverted nipple. I seem to have a strong letdown, which my baby chokes and screams on. Anything I can do to help him? He also seems to have reflux. He's eating well and gaining weight amazingly, all caps, wonderful, but I feel bad for him. Any advice?
Okay. So as far as the nipple shield, you know, when you do have a flat nipple or an inverted nipple, that is one of the indications that sometimes using a nipple shield is definitely going to help. So I'm not sure which advice she's asking for. Is she asking for advice on the heavy letdown, on the reflux? Like, what did she say? She's the struggle is
very strong letdown, and he seems to have reflux.
Gotcha. So when moms have a really heavy letdown, what that means is that the milk is expressing out really, really fast. And sometimes when you have a lot of milk, it's just overwhelming for the baby. So it could just be too much. The nipple shield actually helps that a little because it kind of controls some of the milk from flowing too fast into the baby. But one thing that you can try, there's a couple things. One thing I would try is try a different position where the baby is more on top. So more of a what we call laid back nursing or biological nurturing so that the baby's kind of on top of you. When a baby is underneath the breast and you have that really heavy letdown, there's really nowhere for it to go. And so they're gagging, they're choking on the milk. When you lay them on top, it actually allows them to be a little bit more in control of the flow so they can sort of let the milk pour out, let the milk stop. It's not just pouring down their throat. Think of it just logically of what that would feel like. And the other thing too, you know, when she says the baby has reflux, it's to me, a really overdiagnosed condition. You know, to say the baby has reflux, it could be the baby's just crying a lot. I don't know what the issue is. Did she say the baby's a month old? I think you said that.
Hold on. Just newborn.
Oh, just newborn. Okay. Yeah, you know, it could just be that with that heavy letdown, the baby is gulping really hard. And that is very common, especially in the beginning when you have that overabundance of milk. So the baby's gulping really hard. You've got that heavy letdown. The baby's swallowing a ton of air. And that could cause the baby to have a lot of gassiness.
Desiree is here. She's here. He's
Okay,
3
great.
weeks old.
He's 3 weeks old. Okay. The first thing that comes to my mind, Desiree, is make sure that you're burping the baby really frequently. Okay. Make sure that you're taking the baby off to burp frequently during the feeding. Don't just wait till the very end, and getting those little air bubbles out, because the baby's swallowing and gulping hard. Think about when you drink like something fast, or it has air bubbles in it. That's going to hurt. And getting those bubbles out is going to make a big difference. I have a really good video on burping your baby. It was actually one I was going to show tonight, but I chose a different one. It's on my Facebook page, and it's like a featured video. I have 4 million views on that video, Jamie.
That's crazy.
Crazy. 4 million views. But you know what? So many people comment in that stream talking about how that's really made a difference to help them burp their baby. It's a different way of burping. But the main thing is not just about how you do the burping, but how frequently you're doing it. And that's a big deal. I don't wait a certain amount of time. When you're burping, you're really looking for cues and signs from the baby as to when to do it. And sometimes that's like 2 minutes into the feeding, especially if you have a heavy letdown. Usually the way it looks is the baby will be nursing and then start to arch or pull back or start to wiggle. That's usually a sign that they are swallowing air, or that they swallowed air and need to get a little burp out before they can continue. So that's one thing. And if the baby is, Vanessa just said the burping video is amazing. It's working for you. I'm happy for that. I love the feedback on that video. I've been getting feedback all over the world. People just saying, it actually worked. I couldn't burp my baby. Now I can. So try burping more. That's kind of a simple answer to reflux. The other thing too is just to keep in mind that another big reason why babies swallow a lot of air sometimes can be from a tongue tie or a lip tie, and where they're not latching to the breast well. And we have something we've talked about before, aerophagia, where the baby's actually swallowing a lot of air. Those babies are quite often diagnosed as reflux when it's actually something else that needs to be handled. So, And
you have, just offhand here, you have a Facebook Live coming up, right? Lip tie?
It's Wednesday this week.
Okay.
So Wednesday from 8 to 10, and it's huge. I've got 5 experts coming on. I'm not the expert that night. I'm actually going to be the host. So there's 6 of us on there, but the 5 experts that are coming on are just amazing experts in tethered oral tissues. So we're going to be talking about tongue ties, lip ties, buccal ties, from diagnosis to procedures to follow-up care with craniosacral therapy and a physical therapist and everything else that you need to know about it, and the consequences of misdiagnosis, which is really, really common. So I encourage you all to come watch for the 2 hours. It'll be right on my Facebook page at 8 o'clock on Wednesday Eastern. We have 1,800 people registered for the event.
That's crazy.
Yeah, because you know what? It's a lot of people who, a lot of moms, and then also a lot of professionals that really need to hear this information, because it's kind of not that well known. So I got the best people coming on. So yeah. Oh, Joe put the link into the chat.
That's going to be very sensible. There are a couple questions on here that had to do with reflux, so that's great that we knocked that out immediately. Jennifer has a question. When is it okay to introduce the pacifier? My baby is 9 weeks old and exclusively breastfed. Also, this is like a 2-part question, actually. So let's talk. This is basically a 2-part question. When is it okay to introduce pacifier? And her baby refuses a bottle, so bottle tips, and when should you introduce a bottle? So let's start with bottles and go to pacifiers.
Yeah, they kind of mix together. And I'm a little concerned for her that if her baby's 9 weeks, right? 9 weeks old, is not taking a bottle, and then she's going to just now start to introduce a pacifier. Don't be surprised if the baby's not going to take a pacifier. Most babies will develop a preference for a nipple, whether that's a bottle nipple, a pacifier, or the breast, by the time they're about 3 weeks old. So I usually recommend, once you're going beyond that point, some babies will just reject the bottle. Just like if they start off on bottles, they can reject the breast. It's the same thing. And if the baby's just not taking an artificial bottle nipple into their mouth, quite likely the baby's not going to want that pacifier. You could try, but don't be too surprised if that doesn't happen. I usually recommend introducing the pacifier or the bottle much sooner than that. And like I said, around 3 weeks old, they kind of get a preference for one or the other. And it's babies that are breastfed can do both. Obviously, they can take a pacifier, they can take a bottle, and they can breastfeed successfully. And that's really important for all of us who are moms who pump and go back to work and want to continue breastfeeding. And it's really important to be able to do both. Do it earlier. I usually recommend somewhere between like 1 and 2 weeks, as long as the baby is latching well and you have no problems and nursing's going really, really well for you. I don't see a reason not to start introducing it. What I don't recommend is like substituting full feedings. And so in my class, in my Simply Breastfeeding class, I have a whole chapter on how to introduce your baby to a bottle. And it's pretty early on, and you're doing it with very small amounts, like half an ounce once a day, but consistently starting at like 1 week, 2 weeks of age, and then breastfeeding the rest of the time. You don't want to interfere with your milk supply. You don't want to interfere with like scheduling your baby's feedings or trying to pump a lot or too many bottles right off the bat. But doing it early is kind of important. So for her, the best thing she could do is just try. And if it doesn't work, I have a lot of compassion for you. I waited 3 weeks with my second baby to introduce a bottle and a pacifier, and she never took either. She breastfed exclusively, and that was it, which was great. I'm not complaining, but she rejected it completely.
Yeah. I just want to try an experiment here right now. I'm just thinking of things. If you are watching this right now and you have friends who might benefit from this and you think they don't know we exist, just hit share.
Yeah.
I'm curious. I'm just watching something right now. Hit share and just leave a little note like, hey, nursing moms, hey, pregnant people, like whatever. I'm just watching something because I'm curious. Mm-hmm. I'm nerdy about the social media.
Yeah.
So share the crap out of this for no reason right now other than that I asked you to. And that people might need the information. And the thing is, it's not that they might need it. It's like they probably do need it.
Yep.
So,
Stephanie's making a really good point. Stephanie's one of my great students. Hi, Stephanie. She's saying don't stop for weeks after trying it. So like what I was just talking about introducing that bottle or introducing that pacifier, sometimes people will introduce the bottle and say, oh, the baby's fine. They take it. And then they stop. They don't keep going with it consistently. And then they try to pick it up again when they're going back to work and the baby doesn't want it anymore. So the consistency is really important.
I'm going to have to go back through this and look at some other questions that are actually in the feed. Because the one thing, like, if you're doing this on Facebook Live or this, it does cut questions off after a certain number of characters.
I see a question here. Can I post it on the screen and answer it?
Yeah,
okay.
I can see it.
So here's the question. Can you see the question?
I sure can now.
Okay, you want to read that? Let's see it, because I can't read it. I can see it, but I can't read it.
Pamela wants to know, when is the best time to start pumping before going back to work after maternity leave? Well, sadly, maternity leave here in America is about 6 hours.
Yeah, it sucks.
Way too short.
It's way too short.
This question comes up every single month. Mm-hmm. We touch on this a lot, so go for it.
Yeah, let's talk about that for a minute, because way too often, because so many moms have to go back so early, you really need to start pumping pretty soon afterwards to get a little bit of that stash that you're going to need and at least enough milk for your first day back. If you're lucky enough to have several months of maternity leave where, maybe you're not going back for 4 months, 5 months, 6 months, what you want to do is calculate how much you're going to need for that first day back and try to spread that out over several weeks of pumping. So for example, if you're going back to work and you need, say, 9 ounces for your first day, don't try to pump all that on the weekend before you're going back on Monday. That's not a good idea. You want to start way back. And even if you gave yourself even 10 days to pump an ounce a day for storage, that's going to be the best bet. So what I do is I really have you try to calculate how much you need for your first day back, plus enough to have about 8 to 10 extra feedings in the freezer as an ideal amount. I always say ideal because then people say, you really don't need that extra. You really don't. You're going to be pumping when you're at work every day to bring home fresh milk for the next day. So if you can't store up that extra milk, it's totally fine. Don't stress out. You're just going to need enough for that first day back. If you have enough time and you can store some extra milk in the freezer, that's a really great thing because it'll put your mind at ease and know that you have that little bit of extra. Things happen. Sometimes, you could spill something. I've done it all. I've spilled milk. I've had my mother-in-law spill my milk. I've 16 years later and I'm still talking about it. That's how much it impacted me.
I've spilled milk when I'm like dealing with bottles for nuggets. It happened.
Yeah, exactly. So having that little bit of extra is important, but not necessary if you have a really short maternity leave. All you need is enough for your first day back. And how much is that? That's about 1 to 1.25 ounces per hour that you'll be gone.
Yeah.
And then calculate from there.
I forgot we're using BeLive instead of Blue Jeans for a little bit. And I forgot that you can actually blue.
Yeah, I forgot.
Krista, highlight Krista Woodward Macrones right now.
Okay, hold on. Yes, I do.
She said, what is lipase?
Oh, wait. She said, what is lipase?
Yeah.
Oh, I see it. Okay.
Highlight that. So I just said it myself, but Krista says, what is lipase?
Okay.
And this is a very, very good question. So,
it is a very good question. Mm-hmm. So some moms will complain that, they pump their milk and they go to freeze it or even put it in the refrigerator, just store it in general, but mostly freezing. And then when they defrost it to feed it to the baby, the milk tastes sour or smells sour. The baby either rejects it or you can smell it and it has like a soapy or a sour smell to it. A lot of moms will think that the milk is spoiled. It's actually not spoiled. And if your baby will take it, totally fine to feed the baby what's in the bottle. But what lipase is it's an enzyme that breaks down the milk. And so it's actually in the milk itself. Breast milk's amazing. It has hundreds of components to it, some that we still are just discovering. And lipase is one of the enzymes that starts to help digest the milk for the baby.
Because guess what? I'm going to repeat what you told me a long time ago. We were never meant to pump milk. It's meant to break everything down as your baby eats.
Exactly.
So it is now stored. It changes the properties completely.
Completely. And not for everyone, but for many. And so like we were just saying, milk was not supposed to be pumped and put into a bottle or refrigerated or frozen. Nature did not know that we were going to be doing this. And so it's doing exactly what it's supposed to do, start to break it down. But for those who have that high lipase, you will feel like the milk is sour. There is a way to scald the milk just after pumping it, which is just bringing it to a really high temperature in a pan until you just start to see bubbles around the edges and then store the milk. And that usually helps to prevent the breakdown with the lipase so that it prevents that sour. But some people just say, I can't store milk at all because of it. So, but that's lipase. Lipase is not like it's actually everybody has lipase in their milk. It's just a matter of how much do you have in there and how fast is your milk breaking down.
There we go. I like it when we can pop the questions up.
It's cool, right?
Uh-huh. Okay, this is good.
One more thing. Hold on.
Yeah.
Someone's saying, if you can't, Randy, I think this is Randy. If you can't, can you read that?
If you can't go off smell, then is the age of the milk the only way to know if it's bad?
Yes, really. It's, yes, you want to make sure that the milk doesn't smell bad. But you'll know if you have a lipase issue. Okay. So if you don't normally have this issue and your milk's been sitting around and it's smelling bad, then don't take a chance with it. Okay. Smell is definitely a way to, you can tell it's bad from the smell. It's just that it's not always bad. Does that make sense? Like if you have lipase issues and you know that you did everything right, you froze the milk when you were supposed to, you haven't been storing it that long, and the milk is still not, all your milk seems spoiled, then it's most likely lipase. If you don't usually have that issue and the milk's just been hanging around for too long, it's probably bad. Here's the thing with breast milk. It doesn't go bad very easily. Okay. It just really doesn't. It can be out for many hours at room temperature. You don't have to, so say you're pumping in the middle of the night, you got your pump next to you, right? You're sitting there. This is what I used to do. The pump would sit on the nightstand next to me. I'd pump in the middle of the night. It's when sometimes, for most moms, it's when you have the most amount of milk. Sometimes you can feed the baby on one side, pump a little extra on the other side while you're nursing, which is a great time to pump. It's easy letdown. And then you don't have to run that milk to the refrigerator. You can just leave it on the nightstand for a couple hours at room temperature, as long as especially as we're going into the winter months and it's not too hot. It's unlike formula, which needs to be refrigerated right away. Breast milk does not. And then it can last in the refrigerator for several days, in the refrigerator, and then you can freeze it for months. So it's very stable. Breast milk is very, very stable. Usually we don't have an issue of it going bad.
Yeah. And it's also, breast milk is also antimicrobial and antibacterial.
That's
so
right.
It's not a matter of like breast milk getting infected with all of this crap and you're going to get really sick. It's just about nutrients depleting, correct?
It can
for the most part.
It can go bad. It's still it's still something that can be spoiled and go bad if it's left out and there's heat, or if it's out too long, or it can go bad. But the point is that it does have those things that you're mentioning. It has antimicrobial properties, and it's alive. Breast milk is a living substance. There are there are components in it that will actually kill bacteria. So that as it's sitting there, it is actually cleaning itself and making itself, and killing off the bacteria. So it's an amazing, amazing substance. And, I always say, err on the side that it's probably fine. It's probably still good. Smell it, taste it. And like I said, if something really seems off to you, don't take a chance, but typically it's fine.
Jamie just wrote a question in here, and I was going to read it off the list from today. So her name is Jamie Harvilla or Harvilla. Mm-hmm. Do you see it in the comment thread at all about what are resources for medication?
I don't see it here, no.
Okay, so I'll just read it. I was recently diagnosed with peripartum cardiomyopathy.
Yeah.
I had to start, and I tried to pronounce it in my very best way.
You good?
And I've had to start on medication. What is a reliable source for me to figure out what medication is breastfeeding friendly?
Okay, great. So most medications are fine to take while breastfeeding, although if you really want to check and make sure, especially with the medications like you're talking about for this condition, there's a couple resources. One is called infantrisk.com. You can go to Infant Risk. It's a great resource where you can actually call them up, get someone on the phone, and they'll talk to you about the specific medication that you're taking and any contraindications for breastfeeding. And then there's also LactMed as well. So there's two really good sites that you can call. I was recently at the CAP event, which is the Childbirth Educators and Doula event up in Maine.
How was that?
It was fantastic. It was really great. Really great. Some really great speakers. I had a great time. I love doulas. I just love doulas. I'm a nurse midwife. And so, for me, it's just doulas are awesome. I had doulas for my births, and, I always worked with doulas. So that was a really fun event. And there was somebody who was speaking there from Georgia, Bethany from Georgia. I think I'm going to have her on the show, on my show soon, talking about, they have a great call-in hotlines in their area. So there are places locally too that you can call to find out about, medications and breast milk. But overall, I just want to say that most medications are totally safe to take while breastfeeding.
I also, just in medication in general, what I have learned, because I have a few friends that went to pharmacy school and they're all pharmacists now, is that doctors prescribe stuff a lot, but they don't really know the medicine. And whenever you go, really talk to your pharmacist, because they know the medicines better than an actual doctor does a lot of the time.
It's so true. It's what they're specialized in. Doctors tend to know when to prescribe something for a particular condition, but if you ask them about the interactions, you ask them about the side effects, they really don't know all of that, which is why it's important to talk to your pharmacist. But even then, if anybody tells you that you should stop breastfeeding because you're taking a certain medication, or you should stop breastfeeding because you need to have surgery and you have anesthesia and you've got to pump and dump your milk, or you should stop breastfeeding for any reason, I'm going to just put that in there, any reason at all, it's time to get a second opinion.
Yep.
It's time to reach out to the people who really know what they're talking about. And those are specialists that specialize in breastfeeding. So a lactation consultant, IBCLC, or one of these hotlines that we're talking about, infant risk, like that, to really find out, because very often, this is one of the most common questions I get on my page is, I have to have, I'm having my teeth I've been having a tooth extraction and the dentist told me that I have to pump and dump, or I have to have my gallbladder out. And the anesthesiologist said, because I have anesthesia, I need to pump and dump my milk. This is all very untrue.
Yeah. Well, with anesthesia, it's you're coming out of anesthesia because the medicine is wearing off.
Absolutely. It's very short acting. There's a reason it's a short acting drug. We want you to wake up. And so that means that when it's coming out of your blood, it's coming out of your milk too. Medications and drugs will sometimes pass into milk. It's not all, because there's a lot of different factors of what causes a medication to transfer into your milk, like the molecular weight or the size of the molecules. Some of them are just too big, they won't even pass in. So no matter how much you take, it's not in the milk. Other things are, need to be taken into consideration too, like the route in which that medication works. If you're taking a drug and it needs to be injected through an IV or inhaled, those medications don't typically work if you drink them. And if your baby is drinking them, it does not pass through. It just goes right through them. It's not the same. So it's there needs to be an understanding of what's safe and what's not, and how really stopping to breastfeed or not feeding your baby or dumping your milk or delaying feedings is way more of a risk than the drug that you're taking.
Yeah, pump and dump is bad.
It really
Is bad. So
unnecessary.
While we're kind of on this topic and we were talking about how to know if your milk goes bad, if you have milk that you think is bad, is there anything you can do with it so that it's not wasted? I know some people do milk baths, or they will put it in their toddler's food, or
if you think the milk's bad, I probably wouldn't eat it.
Yeah.
You could definitely do milk baths. Breast milk is, like I said, is probably not bad, but if it does go bad, I probably wouldn't eat it.
What about pink eye?
Yeah, it's good for pink eye, but if it's bad...
I've used it for pink eye,
right,
but I'm just curious.
I don't think I would put it in my eye either.
You never know.
You never know. I would... You know what? It's not usually an issue because it's not usually bad.
Yeah.
Mm-hmm.
Oh my goodness. So many people milk diaper cream, so many things.
Oh, yeah, there's a good thing. You could put it on their butt.
Zits.
Look at that. Such a smart audience.
Breast milk is great for zits.
Hey, can we show a few, show a few images here?
Oh, we can do whatever you want.
Okay. So I want to talk a little bit about milk.
This is the pump we're giving away. And
okay, cool.
This is why we are.
I just want to show off my technical skills. That's all it is.
Yeah. Shari nailed it with this. She nailed it. We could do slides and movies on this. Like, here we go.
Yeah. Okay.
Hearts for technology and graphics.
Love this. Okay, so first we're starting with an image here. This image is showing us just milk quantity. And usually I'm holding up these little bottles. Jamie and I will fill up little bottles with milk to make this demonstration. But this is a really great graphic that shows shows how much the baby's actually eating on day 1, on day 3, on day 10, and then what a full bottle of breast milk actually looks like. Because very often, the reason that we think we're not making enough really has more to do with perception than low milk supply. And I have a whole class on low milk supply. It's an entire class, and a big portion of it is what we're talking about is perceived low milk supply. So I just want everybody to take a look at that image on the far left there and see how little. That's colostrum. That's just a little tiny amount of, it's like a teaspoon at a time. And that's what the baby's eating on the first 1 and 2 days of life when your body's not making mature full milk yet. It's making colostrum, which is amazing. I woke up this morning with a thought, Jamie, I'm going to do a whole show just on colostrum, like, because there's so much that we need to talk about with it. Yeah. I'm doing it. I thought of it this morning, and I was, before I wake up in the morning, I have ideas for what people may need to learn. And that's a big one. So that's on the far left. And then when you look there onto day 3, what it's showing you is that, the milk starts to come in, and you will maybe have more than that, but that's about how much the baby's eating per feeding. And so when you look at that in a bottle, obviously you're not going to see it. They're feeding at the breast. But when you look at that small amount, you realize that babies just need very small amounts frequently. Breast milk is easily digestible. It goes through them quickly, and they need to eat very frequently, but really small amounts. And there's day 10. It's about 1 to 1.5 to 2 ounces. And then the one all the way on the far right is a full, I'm gonna make this a full screen here so they can see it. This is a full bottle of milk here, and that's about 4 ounces. All right, about 3 to 4 ounces is really a full feeding for a baby, and it doesn't really increase from there. It really doesn't increase from there. It's not like you're making more and more and more throughout the year. It's not going up to 7, 8, 9 ounces. It's just not the way it works. And I'm
looking down and scrolling through things right now.
Well, and now I'm going to actually move on here to another image I have.
Very good.
Those are the bag. Those are the bag clips.
Those are the adapters.
So Evenflo Feeding makes these awesome adapters that attach right to your milk storage bag, so you can pump right into the storage bags, which I love. I love this thing. Because it's so easy to use. But that wasn't the image. Those are their bags, and they have really cute sayings on them. I think, you know what it is? I think it's all the way at the beginning. Hold on.
Because we actually went through a couple of them.
There we go. Okay, so this is the Evenflo pump. So this is what we're actually giving away as a prize. This is the Evenflo, and this is everything that comes. This is the deluxe here. It comes with a really nice bag and a cooler. But then this was the image I wanted to show you, and I think I have to make this big in order to show it. Okay,
Go for it.
As we talk about the features on a breast pump, usually we will sometimes show you a video, but I want to talk about the different features to look for. And when you're choosing your breast pump, this is coming from me having worked with breast pumps for at least 15 years now. And the 3 features that I always look for is, 1, making sure that the pump has multiple flange sizes, and preferably included with the pump, okay? Because not everybody fits into the same flange. And so you want to make sure that you have different sizes, because if the flange doesn't fit, and this is the flange part right here, the flange doesn't fit, you're not going to be able to get your milk out. You're going to be in pain, and you just will not get enough milk. So this comes with really nice, soft, cushiony, I don't know if you could see it, soft, cushiony flanges. So it comes with 3 sizes included. And then the second feature that's super important is a closed system. Do you want to talk about
Somebody
it?
just asked if it's a closed system. Yes.
There is.
And
Go ahead.
we've had a lot of questions throughout this because I've been trying to like monitor screens and whatever about how does this compare to other pumps. And some of the other pumps that have been mentioned do claim that they are closed system, but the issue with those pumps is that milk backs up through the tubes. And that is not a closed system.
Right.
You're still dealing with moisture and everything.
Yes.
Closed is nothing in the tube down.
Closed is closed at the point where the milk is actually going into the bottle. The flange is closed from the tubing. Okay. That means there's some kind of barrier. This little barrier that is here is going to sit right inside there. It seals off the entire area so that when you click your tube on, which this one's really, really easy to do. There's not a lot of like multiple parts or anything like that. It's just one, it's really simple. It's one little diaphragm in there, and then you click this on and you're good. And this really prevents any milk from getting inside your tubing, which is important because as milk can shoot into this tubing, it can grow mold and bacteria and viruses. And like I said, we were saying, milk can grow that stuff. If it's left there long enough, it is going to grow stuff. So it will.
And those tubes just suck to clean.
You can't clean this, really.
No, they suck.
It's really, really hard to clean the tubes. And on the Evenflo, you're not cleaning the tubes. The instructions are very specific. You don't wash these. You may want to wipe the outside down, but you're not washing the inside of the tube because you don't even want water to get inside of there. So it's a completely closed. What Jamie was referring to was some pumps will talk about having a closed system. And what they mean is there's some kind of barrier here, meaning that if you get milk in your tube, it won't get inside your motor. But that still doesn't stop the mold or whatever it would be growing in the tube from happening. So you want to make sure that closed is closed. And unfortunately, just like everything in marketing, people can say whatever they want about a product. So you want to just be really knowledgeable so that when you're choosing it, you know what to look for. And then the last thing is, it's really important to have controls on your pump that you can do yourself so that they're independent. You can control the speed and you can control the suction separately, and that you can customize it to what it is that you need, because that's how you're going to get your milk out. That's what's going to help you to stimulate letdowns so that the milk expression is there and that you get the most amount of milk out with your pump as fast as you can. And that's going to help to maintain your milk supply. So having that's really, really important.
And somebody just said, can you name this exact pump again?
Yes.
It is the Evenflo Advanced Double Electric Pump.
Yep.
Depending on which version you get, the Deluxe has a carry bag and, whatever. But it is the Evenflo Advanced Double Electric. Yep.
And every one of them, so if you get the Deluxe, like the one here in the image, that has all the different, really everything that you need. It's the only pump I know that has like the full complete package because it comes with education as well. Both of my 90-minute courses, full online courses, are included with this pump. So when you buy this pump, you get all the classes.
For a retail price of around or sometimes less than $100.
Yes, exactly.
So even if for some reason your insurance doesn't cover it, it is a very, very reasonable price.
Yeah.
And while we're on the topic of insurance, because this always comes up,
yep,
most insurances will cover pumps, not all of them. Of course, right now, we don't know how long that's going to last. But you do not go through an insurance company. Go through what is called a durable medical equipment provider.
Yep.
That's a DME.
Yep.
So Yummy Mummy, like Evenflo actually has their own website kind of built to help you find.
In fact, Jamie, when they click on the registration,
oh yeah.
Okay, when they click on that to register to win the pump tonight, after you click the registration, it takes you right onto the page that will show you, it'll have links to the DMEs that carry the pump. It'll give you all the different videos that I've created that will teach you about how to get multiple letdowns, the checklist of things that you want to look for in a breast pump, and all the information about how to go about getting this particular pump through your insurance, including a really great interview I did with Amanda from Yummy Mummy.
Yeah. Somebody just asked, about how loud the pump is. Just because the pump is quiet doesn't mean it's working. And I have an example of this from ABC this last week. I went and played with a new pump that's about to come out. And as I want to do, I wanted to personally test the suction strength on single versus double pump, because it should be pretty equal if you're doing both. And it was so drastic, the difference.
Yeah.
And when it was in single mode versus double almost had no pull whatsoever. And I could just tell on my thumbs.
Yep.
And I was like, oh, no, this is not working.
It's such a good point.
You couldn't hear anything.
It's such a good point. What are you giving up sometimes? That doesn't mean that it has to be super loud, but, you got to question what you're using it for and what that feature may be sacrificing for you. Noise or sound level is not one of the top 4 features that I have to have as a must-have when it comes to a pump. It must have flanges that fit. It must be a closed system. It must be able to get your milk out with those controls. And the other thing I really like too is a battery.
Batteries.
Okay. Some pumps don't have a battery option, and like I said before, when we talk about this has really a complete. It is like everything that I look for. The batteries in a pump are super important because you want to be able to do that on the go, or if you have any kind of an issue where you don't have an outlet.
We talked about this last month. It was like, all the hurricanes and everything that are going on don't have power.
Yeah.
And, there are a multitude of things that can happen when you don't have power, obviously. But what you don't really think about is that your boobs and the boob flu and things that you can't pump and your supply.
Yes.
So batteries are very good.
Yeah. Well, that's why, when I think of what are the 4 features, it's always about protecting your milk supply. It's always about that. It always comes back to your milk supply. It always comes back to making sure, is the pump going to function when you need it? Is it going to get your milk out so that you keep making your milk? Because that's what the pump is for, period. That's all the pump is for. The pump is just about getting your milk out and maintaining and protecting your milk supply, which is super important. It's the most important thing because that's what your baby needs. So,
and also, you also want to make sure you're using good batteries, and that's just across the board. If you use cheap batteries, the crap happens. I've had batteries explode. Make sure you're using good batteries. And I know that you have, that's a good tip, Elise.
Good tip, Elise.
Do you have the video dialed up?
I do. We haven't shown this one in a while.
Or you did the 3-stage? Somebody was actually asking on Instagram today. They just got their pump today, which I was like, that's exciting because, they got the Evenflo. Awesome. And she was like, I'm still figuring out how to properly use it. And so I was like, go to Shari's Facebook. This video is pinned to the top about the 3-stage pumping method.
Awesome.
So
we
thought that would be worthwhile to show.
Would you guys like to see the video? It's been a little while since we've shown it. A lot of you guys have used this method, and it occurred to me that a lot of people, like the one that the person who posted today on your Instagram, they don't know how to use the pump. And and using a pump is not just about turning the speed and turn it all the way up and just hope for the best. That's not how it works. It really needs to be used in a way to stimulate those letdowns. So,
I stimulate a letdown every time I go on Tinder. It's always a letdown. You go on a date and it's very boring, but that's a whole other Facebook Live. when I go on Facebook Live and I'm like, this is Jamie's dating struggle.
Aw, Jamie. You're so lovable.
Man.
You just need to be in one place long enough. That's the problem. It's not you. It's your traveling. Okay, let's play the video for everybody. You ready? Okay, so let's see. All right, hold on a second. This takes a little maneuvering. Okay, let's do what? I know. Thank you, Joe. Joe's helping me out here. Breastfeeding moms know that pumping takes time and lots of commitment. I have a secret to share that's going to help you get a lot more milk in a lot less time. The first thing you're going to need is a pump that lets you control your speed and suction independently, putting you in control. Start with the pump turned all the way up on speed and low down on suction. This will simulate what the baby does when the baby starts off at the breast to get a milk release or a letdown. Once the milk starts coming out, what you're going to do with your dials is turn your speed down while turning your suction up enough to feel it and not feel pain. Once you see the milk stop flowing, that's when you want to stimulate that second milk release or letdown. This is where it gets good. Turn your speed all the way back up again while leaving your suction exactly where it is. Continue to pump with the speed and the suction turned up until you see the milk releasing or the letdown start one more time. After you see that happen, turn your speed back down and again, repeat. You can stimulate a second, a third, even a fourth release of milk. This is how you maximize the amount that you get out and how you empty the breast as much as possible. All right, there we are. Was the sound off from my voice? It looked like it was not a.
It didn't look like it was quite in sync, but it wasn't bad.
Okay, I couldn't tell if it was from my computer or not, but I hope you guys knew how to. I don't know if you've ever seen that video before, but if you want to go back and watch it again, like Jamie said, it's pinned right to the top of my Facebook page, and really, I'd love to hear your feedback on it. Go ahead and try it with your pump and see if you can get more milk. I post all the time. I get people who send me their collection bottles to show me. They should send me pictures of how much milk they're getting out just from using the method. Makes a big difference. Sometimes double milk. Now remember, the milk is already there. So if you're getting twice as much milk out when you use that method, it means that you're really emptying the breast, which is going to maintain your supply. When you don't pump and you don't take all the milk out, it tells your body to make less milk. So we want to make sure that your pump is efficient.
Yeah. So we'll do like a couple more questions because I rambled at the beginning.
Whatever.
And then we'll call it a night because, we're living our best life. Here we go. Natasha, 8-month strong breastfeeding, my second rainbow baby. My question is it normal to have clogged ducts many times on the same breast? We don't stick to one side to feed. we do both, but it's always my right side to get clogged ducts, and OMG, they hurt.
Yeah.
I nurse as much as I can to help relieve the pain, but it usually takes 2 days to help it go away. Normal, or could there be another issue?
Yeah, that's a good question. Plugged ducts or clogged ducts, however you want to say it, is the milk kind of getting stuck in a particular area so that it's backing up the milk in that spot. And it'll feel like a lump underneath your breast, underneath the skin. And yes, you can have it more on one side than the other. That can happen either from just anatomically, the way that the ducts and everything crisscross within your breast. So it could be that there's an area that's just not getting drained well. It could be that the way that your baby's latching to one side, they're draining the breast well from one side, and then just the positioning of flipping that baby over to the other side is just not draining all areas of the breast. And it also could be, and this is one of the things that a lot of times you don't think of, for moms who are sleeping maybe on one side facing the baby, right? So you got your baby in a co-sleeper or near you, and then you're sleeping on one side, and you're putting a lot of pressure on the one breast while you're sleeping. It's typically when I see it, if it's happening more on one side than just both. So it could be that pressure from sleeping on that side is causing those plugged ducts, as well as sometimes baby wearing, and you tend to favor on one side versus the other, right? So more pressure on one side. That's okay. You're going to make it contagious, though. Oh. So I would say that what I would do is check out your positioning, see if that's happening, see if something else you're doing when you're not nursing, like the position you're sleeping in, or is your bra, sometimes, our breasts are not even sizes either as well. So if one side is bigger than the other and the bra is too tight on one side versus the other, that could cause plugs on one breast and not the other side. I'm just thinking of all the reasons why you may be seeing it on one side and not the other. And then the thing to do about it is to make sure exactly what she's doing, emptying well, make sure she feeds a lot on that side, massage the breast and feel for those lumps before they actually get too bad. So sometimes you could just feel it starting to accumulate. And when you're nursing, you just kind of massage that area, and it will start to drain out, and moist heat too. Moist heat on that area before and between feedings is going to help to relieve those plugged ducts as well. So keep doing that, because if you don't clear out the plugs, they will keep backing up the milk. They can cause mastitis, like Jamie said, the boob flu. You can get an inflammation of the breast tissue, which is not fun, and it really can make you very sick. So you want to address it quickly. And then on top of it, if it keeps staying backed up and you're not expressing it, like I said before, the milk that doesn't get expressed, your body gets the signal to make less. So you will eventually start to decrease your supply as well.
Carly Henry has a question, and I can't scroll back because of the way my app works.
Let me see.
And just because she has been very loyal for years, and she's got her little nugget baby now, she has a question about supply, and
how far back?
Hopefully you can get back to it, or Carly can repost.
I got it.
Okay. Do we have anything else to suggest higher supply? I'm dipping a bit, it seems, when I pump, and I'm worried she's not getting enough at breast. So I remember Carly had written in another question about, wet diapers and all of that. So let's talk about, how do we know our baby is getting enough? How do we know they're satiated,
Great. It's the biggest question that nursing moms have, is questioning their supply and is there enough? I mean, it's always the biggest question, and it's always the biggest worry about whether you actually have a low supply. And I saw Conchita on here. She's one of my students too. And it's actually how she found me, was she had been searching through and found and did a search on Facebook for low milk supply and came across my class and realized for herself that she actually didn't have a actual low milk supply. She had a perceived low milk supply, which is the most common kind of low milk supply. Perceived. That means it's not actually low. You think it's low because you think you should be making more. Okay. So how do you know the baby got enough? When you're nursing, you can't see how much milk is coming out. So nor would we be able to tell you this is exactly how much your baby needs to eat. Each baby's different. Each baby's going to have a little bit, each feeding's different. The baby might eat more in the morning than they do at night. It's what happens, okay? It's what we know happens. The milk is different in the morning than at night. Higher fat content at night. They need less quantity of it. So when we're talking about here, do I have a way to suggest a higher supply? The way to tell that your baby has got enough milk, 4 real ways to know is, first of all, feel your breast before the feeding. And this is especially in those beginning feedings. Feel your breast. They're going to feel fuller. And sometimes moms will say, I'll have consultations. Moms come in for consultation. I'll say, does your breast feel full? I don't know. It's only after the feeding that I say, feel it again. They're like, oh yeah, I can feel. Now they feel empty. So feel your breast before the feeding. Feel your breast again after the feeding. If you can feel a difference, you know milk came out. There's something went in. If the pillow's not wet underneath you and you're not soaked, it went into the baby. It's a very logical step, okay?
It doesn't just evaporate.
It doesn't just evaporate. It was there, now it's gone, baby ate it, okay? So that's the first sign. Second sign is you're looking for, you're listening for audible swallows. And that means that you don't want your baby just sucking. You want to actually hear some milk going down. It can be very faint, so you're listening carefully for that sound in the throat, like the. These are sounds of the milk actually going down. And you'll usually see that after the letdown happens. The baby will start to swallow. Lots and lots of swallowing is a really good sign that your baby's getting a lot of milk. Third sign is you're looking at what's coming out instead of what's going in. Because obviously, like I said, you can't see it. But you can see wet diapers and you can see poop diapers. So you want to make sure the baby's actually hydrated and putting out at least 6 to 8 wet diapers in a 24-hour period. That's going to tell you that the baby's getting enough fluid, okay? It's not an emergency if the baby's peeing well. And also poop in those first few weeks. We want to see a couple of really good seedy bowel movements, that yellow seedy poop.
Oh, I hate that!
No, you don't like it?
Movements. How dare you?
That woke him up.
Well, no, the thing is, like, I'm not tired, but out of this eye, it's dark outside, and then I have a lighting unit, and it's this weird white light that makes me very tired. It's the weirdest. Like, it's like, it just makes me want to go to bed. It's like being on a plane. It's like.
Or maybe it's me. I don't know, Jamie.
No, it's always you. So let's take it from seedy bowel movements.
Seedy bowel movements, yellow seedy bowel movements means good milk, okay? And remember that after a few months, the baby might actually, or even several weeks, the baby might slow down on those bowel movements. So they're not going to be every single feeding. They're not even going to be every single day, and that can still be normal. Main thing is you want to see that your baby is going in an upward direction, gaining weight, even if it's slow. Breastfed babies can grow pretty slowly. They don't have to gain a tremendous amount of weight. It's about 4 to 8 ounces per week on average. And that means you're not weighing the baby every single week. You're waiting a month, and then you're kind of calculating it out to see is the baby growing. If they're going in a good direction, they're hydrated, they're reaching all their developmental milestones, and everything's looking fine. They look healthy, they feel healthy, they seem healthy. You know, if it quacks like a duck, right? It's a duck. And so these are the things where I don't really like to have a really strict, the baby needs to eat this amount, or the baby needs to eat at this time, or the baby needs to gain this amount of weight. All babies are different because people are different. We need to look at the whole picture. So if your milk supply is decreasing, that could be normal. Okay, that could be normal. You know, as your baby gets older, you're not going to necessarily have the same amount as you did when you were engorged in those early weeks, all right? So that's a normal thing. Plus, babies typically hit normal growth spurts around 3 weeks, 6 weeks, and your milk supply does seem like there's not enough because your baby's going to help to increase it. That's what they do. Again, we're going over some really, really important topics that I'm kind of breezing through right now, like growth spurts and how do you know your baby got enough and all these other things. And if you're sitting there thinking, wow, I need to know more, these are full chapters in my classes.
Yeah.
In Simple Breastfeeding, I do a whole chapter on how to introduce your baby to a bottle. How do you know they got enough? growth spurts, an entire chapter. And then there's an entire 90-minute class just on low milk supply. So these are some really important things that you want to become really knowledgeable and educated on. If you get the pump, you're going to get both classes, not low milk supply, but simply breastfeeding and breast pumps and briefcases, so that if you're going back to work, you know how to use, what you need to do, how to calculate your milk, the milk you're going to store, everything about pumping and storage.
It's interesting because we talk about this and it's like people just assume they get their pump and they're going to know how to use it. There's no difference in that and like a car seat. A car seat, you
right.
just don't know how to use your car seat. You have to talk with people that know how to use it, learn how to install it properly, really read your manual. And a lot of people don't do that with breast pumps.
Totally.
And
I'm looking here, Carly's posting here saying, currently going through those
classes that came with the pump.
Awesome. Yay. So excited. That's wonderful. No, it's really gonna give you the knowledge. And honestly, I really feel like the most important thing you can do to be successful with breastfeeding is to become knowledgeable. You're your best advocate, your best baby's advocate. You need to have that knowledge, that information, and that is going to give you the confidence. And that's really breastfeeding. A big part of it is having the confidence and the commitment to breastfeeding. With the right knowledge, you'll make the right choices.
Sean Barton. I see you here.
Hey, Sean.
That's also the worst thing about I love that technology allows us to do this remotely, but it's also I'm looking here to read, I'm looking at a comment here. So my eyes are always just
I know, we got a lot going on all around us, right?
Oh, it's a lot. And we love you, Sean Barton. So there we go. We've been going for about 8:15. If you want to stay on, whatever.
Oh, are you going to bed and leaving me here?
I'm gonna abandon her as she takes over my Facebook page.
We'll just have a little takeover here. Except that I'm actually 2 hours ahead of you here in Jersey, so it's late for me. And I got a big show on Wednesday. Everybody come watch that show.
Yeah, and I have to wake up early because I'm giving away a big old stroller.
Yay!
In the morning, so that'll be very good.
And we'll be doing this again soon in LA.
In LA on the 4th or the 5th. Yeah.
So only 2 weeks or so.
Yeah, in 2 weeks we'll be back and we'll be in person.
Oh, that's the best.
We don't have to use this. And it'll be great. And we'll be at LA Baby Show together.
That's right.
And it'll be wonderful. I'll be there with all the Evenflo folks. If you're in LA or you're in the area, come on down or up or go west, whatever it is for you. Shari and I will be doing a breastfeeding and pumping Q&A Saturday and Sunday. I will be doing a baby gear Q&A both days. And we'll just be living our best lives. And Sean Barton will be there.
And so will Joe.
Everyone will have a significant other, and I will have my wine.
Jamie.
So.
Jamie. You've got a million people who love you, Jamie.
Well, I try my best. Yeah. So, yeah. We nailed it tonight. There's a ton of good info here. So make sure you tag your friends that may benefit from it. Make sure you share with your friends. And we're just trying to get the information out there, which is the whole purpose of this Q&A.
Yeah.
So just helping y'all.
Hey, Jamie, can I just make an announcement too while we're on?
Yeah.
If anybody's out there and you're, pregnant or you're just starting to breastfeed or you're just looking for more support, Joe and I, we're launching our membership site in just a few weeks. And so people are really excited about the idea that we can work a little bit closer together when we do that. And I think that it's going to be a super useful resource for a lot of moms, because sometimes when you post here, everyone that you know can like kind of see what you said. And when you do it as part of our membership, it'll all be private, and I'll be able to do some live streams where, you know, we can do it more frequently and get your questions answered. So I just want to let everybody know about that. Follow, and I'll tell you more about it as we're about to launch it.
Yeah.
Thanks.
So there we go. And I will see your face in like 14 days or whatever it is.
Yay.
Yeah.
Thank you, Evenflo.
Yeah, thank you, Evenflo. Give Evenflo some love. Go like their page. Give some hearts.
Definitely.
And just share the crap out of this. So there we go.
Love you guys. Love you, Jamie.
Love you. Talk with you later.
See you in a few.
Yep.
Bye, everyone. Good night.